Thank you for staying with us. Now, losing a parent can be heartbreaking. Losing both, that can be devastating. Unfortunately, this is the sad reality of many children and young adults in nations ravaged by conflict. Many of such persons who have become orphans after losing their parents through different circumstances have to face harsh realities of life and fend for themselves. Some of them often end up in orphanage homes, but these facilities and their facilitators most times are overwhelmed by the burden of caring for so many people with very little resources. Access to basic necessities of life like food, potable water, electricity, and quality education for the orphans are hard to come by. Stakeholders now want governments at all levels to support operators of orphanages to improve quality of care for orphans. Joining me now via Zoom for more on this is the National President, Association of Orphanages and Homes Operators in Nigeria, Dr. Gabriel Oyediji. Good morning. Thank you for joining us.
Good morning.
Now, help us understand the challenges, the burden of your orphanages, and home operators face while trying to take care of orphans.
I would say it's an hydra-headed burden, and it's very, very challenging. When you have to run a home or a social care institution privately in Nigeria, it's a lot of burden on you. And we have been trying to call on the government to give attention to the predicament of homes and orphanage operators in Nigeria. It's getting more discouraging and quite boring. You can imagine if you have to go by UNICEF statistics of 2008, and it gave us 17.5 population of orphans and vulnerable children in Nigeria. Now, out of this figure, 80% to 85% are in privately homes and orphanages. The government runs maybe just 5 or 10% of this figure. Unfortunately, the fund for private home to operate is not there. And many homes are struggling, battling. We have to be bothered with the responsibilities of education, responsibility of health management, responsibility of facility management, responsibility of staff payment, responsibilities of everything is on our neck. So it's very, very tasking. It's very tasking. Before COVID-19, there's the philanthropic engagement was about escalating and trying to give us some relief. But after COVID-19, many of these companies and individuals also became victims of economic depression occasioned by the incidences of COVID-19. So it's the most difficult times for homes and orphanage operators all over the country. The government budget, made for social services in Nigeria, shows that we are not too interested in it at all. If you look at the relativity of the budget given, you will find out that among all the social care supervisory ministry have, it's not there. It's insignificant. We have imported quite a number of foreign policies and good ones. And one of those things we have imported from European and other international companies is child rights law.
Right. So what has been the level of engagement with the various levels of government? Because when we talk about government involvement, it's not just the federal government. We can also look at the state and perhaps local government.
Yes, I want to say all those three levels of government are largely supervisory. And the relationship is a relationship of demand without supply. What we learn in economics is demand and supply. What we are facing is demand without supply. Get this, get ambulance, get 3 social workers, get qualified this, get qualified that. but no home has a regular grant from either local government, state government, or federal government. Even they are also managing to survive. They are even managing to do their social work because they don't have funds themselves. So it's a tragedy, and it's very pathetic, sincerely.
So,
and that's what we are saying.
So how has this impacted, or how is this impacting the lives of the orphans in these orphanages and homes being run by your proprietors?
Yeah, it affects quality social service, quality services, intervention services to these children, because the whole thing boils down or come down to the children. So in those, children could not have the best of the school to attend because there's no fund. Operator has to manage anywhere he can to make sure either they are standard or not, then go to school. No standard food because operators have to manage what they have. They won't go about killing themselves because they want to feed the children. You just have to give them a sustenance food that we can cope with. And when you go to health facility too, well, I want to appreciate the Lagos State government in that area because they just started the health service scheme for homes and for social care institutions in Lagos State, where you can take your child to when they are sick and get treated easily. But other states have not gone into that. I think other states is also planning to join suit. But I think you see lobby in public institutions and pay heavily to take this care of these children and wait the whole day. There's no hospital dedicated for the care of orphans and vulnerable people in Nigeria. No special department in general hospitals where they take care of people who are in that. They have medical social workers there, but they're also incapacitated. There's no dedicated doctor for them. There's no dedicated department in any clinic for vulnerable people, including children.
It's quite a complex challenge as we speak. But some of your proprietors are saying that perhaps government should begin to look at how it can ensure that the process of adopting these children is looked into, making it less cumbersome. Since there is a challenge for some of these homes to having to take care of these people, make it easy for those who can adopt them and take proper care of them to come adopt them. What say you with regards to this aspect?
Yeah, that's right. But let me also make this clear. Not all the children in orphanages are adoptable. In fact, there are three categories of children in orphanages. We have children under care and protection that we cannot go for adoption. Either there's a family disparity problem in the family, either they are going through court processes, so not all the children, such categories are placed under care and protection. Nobody can adopt them because they still have matters going on in court. But when people see them in orphanages, they feel they keep them there to merchandise and to decorate the home. It is not true. It is not true. The fact is that we don't keep them there for that purpose or purposes. Number two is that there's also adoption crisis all over the country, and there have been escalating incidences of infertility. And we have been talking about that government should be proactive and we should not wait until half Nigerians become infertile. And they have to do something about it. There's a crisis of adoption all over the country. There's an uncontrollable pressure on homes and orphanages. And there are also when we also brought the child rights law, when we began the implementation. Before the implementation of child rights law, states like Lagos State were using discretion to make sure children don't stay in homes. They speed up the operation and it was going smoothly. But when anything they call courts, it has a process, and the process will be completed. When we brought the child rights law of 2007 and 2015 adjusted, it became mandatory that court guide the whole process, and nothing in court in Nigeria is fast. So when these children are there, between the window of time, between the time they get to the home and before their cases are cleared, investigations are done, the police and all involved completed the investigation before a judge or a magistrate make a ruling. It takes a lot of time. What now happens to the children within that time frame? So it's not that we keep them there, so that we want them to go out. The earlier they go out, the better for them. In fact, we are working together with various organizations in decentralizing homes. Homes is not the place where children should live forever. It's not a place where orphans should be forever. They need family-based care, and we are advocating family-based care so that these children can live on that. But the state governments also have the handband by court process. They almost to have the handband. Every time we have to be taking children to court to get, and sometimes investigation process is so complicated by magistrate that they don't get to do it on time. And so that's the tragedy of our activities. So when you see children in orphanages, they are not all adoptable, one, and two, they also, even those adoptable, have to pass through family court legal process, and every process must be completed, and family court will not be in haste to do anything if they are not completed investigation, because their judgment will be based on investigation submitted by social workers and probation officers.
So what, in your view, will make the process easy? Are you saying that this legal processes should be put aside and perhaps put up a new structure that would be easy and smooth, such that children can be easily adopted?
Yes, we are thinking of how devices are now to fast track the adoption of children from orphanages, as well as decongesting the homes. But the fact is that, you believe with me, the court has its own process and processes.
Absolutely.
And no matter will do a ruling without having a good judgment of the case. They have to look at the case factor and on the basis. So since we are plugged into the process of child right law implementation, we have no choice than just to be patient, and because they have to, nobody can jump the gun when it comes to court process. The ministry cannot jump. The ministry have been doing a lot of advocacies for judges and magistrates to speed it up. They've been doing a lot of advocacies for all who are concerned, particularly Lagos State Ministry. They have been doing a lot of advocacy to make sure this thing go on. They are not comfortable with the number of children hanging in homes, but their hands are tied, because a court process is a court process, and nobody can fast track it.
So where does this leave this whole challenge?
Beg your pardon?
Where does this leave the whole challenge if we still have to focus on the process?
The challenge is fundamental. The challenge is fundamental, and I want to say that it is not even the ministry now, but the courts.
Right.
It's in the courts. It's in the court process, and child right law demand and requirement.
Okay. For want of time, we'll have to leave the conversation here now, but we must thank you, National President, Association of Orphanages and Homes Operators in Nigeria, Dr. Gabriel Oyediji, for your time.
Thank you.
All right.